for 3.5 years after the introduction of this calamity of the mRNA shots that everyone now understands has killed countless souls throughout the globe, potentially damages every organ system, potentially transfers over to the next generation, transplacentally, and through the mother's milk. We know this is a problem. We know it's negative effective. And yet, not only do we not have a political movement in place to take them off the market, but the very manufacturers are now reaping the benefits of the crime that they sowed. And now they have gotten approval for their next respiratory viral mRNA shots. Moderna just got their mRNA RSV shot approved. Pfizer and GSK already had their shots approved last year. And a number of seniors and pregnant women, young children now being exposed to this. They want everyone to have this. Now they're looking at bird flu mRNAs from Moderna. And it goes on and on as if we have learned nothing about the cancers, the cardiovascular ailments, the exposure to fetuses, the hyperinflammation. Does nothing matter? Well, look, I don't know what we can do politically at this point, but at an individual level, we need to arm ourselves with the science and the data so you could take to your pediatrician, your OBGYN. And one thing I've noticed, my oldest kid was born 2010, and my youngest child was born 2020. And one thing I noticed in between is that there is now a tsunami, a blitz on pregnant women and even their husbands to get a whole litany of vaccines, the old ones and now a bunch of new ones, precisely during the pregnancy. And after everything we've learned from hyperinflammation, from the COVID shots, what do you think's going to happen when you bomb a pregnant woman with an endless litany of this uncontrolled spike of antibodies, immune suppression of cellular immunity, and all of the other problems, particularly now with the mRNA shots and the RSV shots? Are we thinking straight? Well, it turns out, and for those of you watching, we'll put up a slide here. In 2016, as part of an omnibus bill, Congress passed very quietly the 21st Century Cures Act, which in Section 3093 here extended the liability shield to childhood vaccines to pregnant women as well. So, in other words, crime pays. Vaccines that are used off-label should, if anything, be on the hook for more liability because they're unproven. I mean, we don't give women Advil. We don't give women anything when they're pregnant that hasn't been affirmatively proven through clinical studies that they're safe. And yet here we have a bunch of vaccines that have never even been tested in pregnant women, that they're recommended, and sometimes to the point where the OBG will kick the woman out of her practice if she doesn't get these vaccines. Well, that's what it turns out, that we have this liability shield that was passed in 2016. So suddenly the last few years, there's just this blitz upon pregnant women. What are we doing to the next generation of humanity born after everything we should have learned from the bleeding of women, the fetal maternal irregularities we're seeing? Have we learned nothing? Well, certainly one doctor has learned something. Dr. Peter McCullough, famed cardiologist, internist, epidemiologist. He's chief scientific officer of the wellness company. You could follow him at P_McCullough MD on Twitter. Also a very high quality Substack, Peter McCullough MD, with endless amounts of information to arm yourself. And of course, he's with us today in person. Hey, Dr. McCullough, it's been way too long. Thanks for joining us again at Blaze Media.
Well, thanks for having me.
All right, look, you heard me filibuster there, Doctor. I don't understand what's going on with pregnant women. I mean, I think by now most people understand the COVID shots are a problem. So they're not going to, on their own, go out and get a new one. But when they have a change in their status, namely a pregnancy, the OBG is saying, all right, you need COVID shots, flu shots, now RSV shots, all respiratory viral vaccines that have turned out to be problematic. TDaP, make sure you're up on your schedule. What do pregnant women need to be armed with when they go to their doctor to ensure the safety of their child?
Yeah, I'm a practicing internist cardiologist, so I see pregnant women in consultation in my practice. So this is within the scope of my practice to help make these determinations. For decades upon decades, we had improvement in maternal statistics. That is, reductions in maternal mortality, improvement in fetal survival, the whole development of neonatal ICUs, uh, drugs that worked fine through the labor and delivery process. All of that was perfectly fine. When my wife had our two kids, there were no vaccines for pregnant mothers. None would ever be considered. And the reason why we would never consider a vaccine is vaccines can cause inflammation and they can cause fever and an immune system reaction, and that will trigger a miscarriage in the first trimester, a stillbirth in the second trimester, and then premature delivery, and then actually having a premature baby in the third trimester. And premature babies have much higher risks of cerebral palsy, intracranial hemorrhage, cardiopulmonary problems. It can be really just a disaster to have a premature baby. So what happened was none of the vaccines had advertising labels for pregnant women. They didn't do large prospective double-blind randomized placebo-controlled trials. They just, in a sense, kind of were brought on the schedule. So around 2003 or so, the diphtheria, tetanus, and acellular pertussis vaccine was introduced. This is the TDaP. Well, we get this through childhood, and there wasn't any particular risk to pregnant women. In fact, before that time, there were only 4 cases of neonatal tetanus, 4. Now, in some countries where, honestly, where pregnant women deliver babies in very dirty conditions around dirt itself, there can be a higher risk of neonatal tetanus. Tetanus is, is treated easily with, we have all kinds of antibiotics and other anti-infectives we can use. Diphtheria and pertussis, those are treated with azithromycin, which is safe.
How often do you see diphtheria?
Well, we probably wouldn't even recognize it because if there was a cough with productive sputum, we'd use azithromycin. So the point is, that wasn't that compelling. There was relatively a little uptake. And then about 10 years later, we saw, again, for no particular reason, influenza vaccine being added to the schedule. And it was right around the time where this indemnification came in that you pointed to, this legislation. And why would pregnant women suddenly need an influenza vaccine? Again, influenza, typically a mild infection in young, healthy women. And, pregnancy is a robust immune state. It's not an immunocompromised state. So women who are pregnant in general do better with infections than non-pregnant women.
So we're just bombing away at women for no reason. Now, I just want to give the layman a sense of the mechanism of action here. What's become clear of the COVID shots, but I think is true of others, is that obviously it does stimulate your immune system. I mean, that's why we're trying to do it. We want to dump a bunch of antibodies in your body. Now, we've since learned that certainly with the COVID shots, you have both an overstimulation, but then sometimes suppression of other elements of it. We have this IgG4 production, the tolerating antibodies. So describe what happens when you have a fetus growing and you throw at the woman a bunch of these shots that stimulate the immune system.
Well, immunoglobulins, particularly the longer lasting one, IgG, and there's 4 subclasses, they should pass through the placenta to the baby. They should also pass through colostrum, which is the kind of watery part of breast milk. And so there is this, I guess, theoretical advantage to babies, but the babies themselves are not at any particular risk of any of these problems either. It just seemed like maybe this came out of an era of precaution or this, general hubris of what I call vaccine ideology. Vaccine ideology is this blanket acceptance by doctors that the human body is inherently weak, and through the brilliance of science and mankind, we can make the body stronger through vaccination. But vaccine ideology says, listen, these vaccines aren't perfect, so everybody has to take them in order for them to work on a population basis. And if there's injuries or even deaths due to the vaccine, you have to take it for the team. And this vaccine ideology is a very disturbing type of thought pattern to be presented. If I was a young mother, I'd be saying, wait a minute, I got to take one for the team. Now, if we were to fast forward, now the COVID-19 vaccines come out, and specifically through the Pfizer, Moderna, and Janssen and Novavax programs, they specifically excluded pregnant women. So in the large clinical trials, they said, wait a minute, we can't take pregnant women because the vaccines may harm the mother or the baby. And so they're specifically excluded from randomized trials. And so Pfizer was the first to come along, and it got emergency use authorization December 10th, 2020. And the first week of its public use, over 3,000 pregnant women took a shot. And so the questions on the table is, why didn't the people in the vaccine center say, no, you shouldn't take the shot because, 2 months ago, pregnant women were excluded from the trials. There's been no information on safety for the mother or baby. And then what pregnant woman in the right mind would take a brand new genetic vaccine that's never been tested in any way, shape, or form on a pregnant woman?
And I love the way you put it with vaccine ideology, because that's what it is. It's like you could have something that is a really good therapeutic or surgery intervention, but you don't say I'm pro-surgery. It depends on the situation. It's not a categorical thing. And I think the vaccine ideology is this brave front they've put up that there's not a single vaccine that has a single potential risk anytime, any place. So, hey, just get it through, transfers through the placenta, and will convey immunity. Now, we'll get to the efficacy in a minute, but it's a two-way street. It will convey the problems as well. And even in the best look of these things, it does create more inflammation. It does, we are seeing Guillain-Barré in a lot of these trials with the new RSV shots. And obviously the respiratory viral vaccines, we have the potential for negative efficacy with ADE. And they don't want to recognize that. So you're upfront injecting a risk into the mother preemptively when you're not compelled to give something to intervene, under the assumption that maybe you will prevent what is really, like you're saying, mild illness.
It's true. If I was a pregnant woman and someone said, listen, if you got, on the off chance you got diphtheria pertussis, do you just want to take a Z-Pack? Or do you want to risk a shot and lose the baby? You'd say, listen, I'll take my chances with taking a Z-Pack, which is safe and commonly prescribed. Now, as these COVID vaccines came in, I was paying attention to this. There was a report by Pinellas and colleagues, but before the vaccines, published in Annals of Internal Medicine. Pregnant women did better with COVID-19 than non-pregnant women. This is very important because pregnancy is at a robust immune state. And OB-GYN departments, including the one at my hospital, were routinely testing every pregnant woman. And for years, the COVID positivity rate was 5 to 15%, just for years. And so, these pregnant women had the virus. It wasn't a big deal. But the American College of Obstetrics and Gynecology, by the spring of 2021, said pregnant women should take these shots at any time during the pregnancy. So so in the first trimester, that's when the baby's organs are forming. We would never want to give a genetic product that could influence the genetically driven encoded organ formation. Just never. The middle trimester is when the pregnancy is moving along, and the third trimester is preparing for delivery. Now, the vaccines relatively quickly were identified to cause both clotting and bleeding. This is something we would not want to have happen in a pregnant woman. If the placenta clots off, there's placental infarction and then fetal anoxia. Or if there's bleeding, then we risk maternal and fetal hemorrhage. So what people were scratching their heads, what is the American College of Obstetrics and Gynecology, what are they doing? And then Dr. James Thorpe and his wife, who's an attorney, Maggie Thorpe, through Freedom of Information, got the FOIA request on the Biden administration HHS COVID Community Core Program. And they basically uncovered that ACOG, this board, had taken millions of government dollars to push the vaccines.
Yep. So it's ideology or it's money or it's both, but money certainly qualifies as ideology. I just find that astounding that after everything we know, not only are they continuing to recommend this, and a lot of doctors are reporting hemorrhaging with a lot of pregnant women, even at birth. But then we're taking it now to the next level, which is RSV. And I was warning about this 2 years ago, but I never thought it would be this quick. This was the original bad vaccine that was pulled in the 1960s. You had negative efficacy, antibody-dependent disease enhancement. Just last year, Fauci wrote a paper in Cell, co-authored, where he admitted, and it's not a direct quote, but roughly, that the respiratory viral vaccines, and he included RSV, they're not ready for prime time. We need innovative thinking, next generation. But then they just come out with it, despite GSK finding neonatal deaths and a signal for preterm births. And Pfizer's version is almost the same, but Pfizer gets approved even though GSK's was taken off the market. Now we have Moderna's mRNA version, which is a whole nother layer. So could you just give a synopsis of what pregnant women need to understand, really everyone now, certainly seniors, about these RSV shots, that they're just running down the field without any safeties in the background to tackle them?
Well, let's just finish on RSV, on COVID, before we go on to RSV. So as these COVID vaccines rolled out in pregnant women, there were reports of just horrific things happening: maternal fetal hemorrhage, miscarriage. And there was a very controversial paper published in the New England Journal of Medicine by the CDC, by Shimbaruku, that it depends on how you actually did the numerator and denominator. The miscarriage rate of women taking the shot during pregnancy could be as high as 83%, which is stunning. A standard miscarriage rate in the first trimester is about 15%. And after that time, it was great controversy. There was hundreds of letters to the editor of New England Journal of Medicine. And finally, the CDC backed down, and Shimbaru backed down and said, listen, we just don't know, because women weren't followed for 9 months. We don't have all the data. We simply don't know if they're safe. And then after that, there's been about 36 papers that have declared the vaccines are safe in pregnant women. And most of them are from, if not exclusively from, vaccinated doctors who are members of the American College of Obstetrics and Gynecology at mandating institutions. Almost all of them don't follow women through the entire pregnancy. They take shortcuts. For instance, there's one from Beth Israel in New York that caught my attention, where they vaccinated patients, pregnant women there. They had their babies at Beth Israel. And then they said, well, when they had complications, they didn't come back to Beth Israel, so we don't know what's going on. Let me tell you, I can tell you, when patients have a complication at one hospital, they always go to a different hospital. So, so these types of studies basically falsely made the vaccine look like it was safe. And then we had the Thorpe papers coming in. James Thorpe, maternal fetal medicine specialist, no bias there. He analyzed it. We used the VAERS system, Vaccine Event Reporting System, about 400 peer-reviewed papers using VAERS. And we found, compared to influenza. And so what the CDC says is, if you're going to do research, you need to compare it to something. So compared to influenza in pregnant women, the COVID vaccine was multifold, much higher risk for fetal loss, miscarriage or stillbirth, maternal fetal hemorrhage, and then fetal malformations. This is really terrible. Wow. Fetal malformations. Since that time, Pfizer has quietly reported their prospective randomized trial in pregnant women. And it was a small trial. They stopped early, but it was randomized placebo-controlled trial. And they showed a 4-fold increased risk of fetal malformations. And these are genetic vaccines. And now we have a recent paper that's just come forward by Igiarto and Quinn from Thomas Jefferson University. And they are reporting logarithmic increases in the rates of birth defects after vaccination. And that's just generally reported. That may not be just pregnant women taking the shots. That may be mother or father taking the shots at any time before conception. So Ray Stricker and myself, Ray's at San Francisco. He runs the largest fetal loss clinic in the United States. In 2010, published on Trial Site News, an opinion piece where we said the COVID-19 vaccines are pregnancy category X, meaning X means they have a dangerous mechanism of action, and we have no assurances on short or long-term safety. It's not looking good, and we stand behind that. But then, as you pointed out, nobody seemed to care, and then the RSV vaccines were advanced. Now, this is it's a very interesting story. So you have GlaxoSmithKline and
Pfizer,
and you have Pfizer, right? So they do studies in pregnant women, not to help the pregnant women, but to theoretically pass antibodies to the babies. Because there's really babies, about half of babies get RSV every year. It's a very stable virus, easy infection to treat. And so what happens is Pfizer's data are equivocal on safety, and they ultimately get approved. And then GSK pulls out and says, ooh, our vaccine is causing premature delivery. So GSK pulls out. These are studies done in the third trimester. So Pfizer gets approved, but it has the warning on it. It says, listen, may cause premature delivery. And the theoretical benefit to the baby is very modest, no significant reductions in serious things like hospitalization and death. It is very, very marginal. GSK and Pfizer then pursue adults, people my age over 60 with RSV.
I've never heard of a senior having problems with RSV. I mean, even the flu maybe, but not RSV.
Adults generally don't get it. In the clinical trials, it was less than 1% of people ever got it. As an internist, I've never even tested an adult for it. And then the FDA gives them approval for both the GSK and Pfizer vaccines. Now, both of those vaccines are antigen-based vaccines. So they're the pre-fusion protein antigen-based vaccines. Probably reasonably safe in adults, not terribly effective, but reasonably safe. Not going to make a big impact because the absolute risk reduction is less than 1. But they don't stop there. There's this RSV campaign with a massive push to test for RSV using the PCR test. So if you look at any annual data on RSV, it's a very stable virus. Suddenly, when we have vaccines and other products, the rates start going up because there's more and more testing. The CDC makes these incredible claims, like many tens of thousands of babies are hospitalized with RSV. They claim 300 to 600 deaths, but these aren't adjudicated. We can't possibly know if that's true or not. It's not citable or referenceable. And before we know it, we have Beyfortus. This is stunning. Beyfortus is a AstraZeneca product that is a monoclonal antibody against respiratory syncytial virus. And starting in October of last year, all babies on the day of birth are getting Beyfortus, 0.5 cc injection of monoclonal antibody. Then at 8 months, they're getting a full cc with no information on safety. So we have no idea how this is going to change the baby.
Wait, Dr. McCullough, even if they got the Pfizer pregnant female shot, I mean, through the mother, supposedly conveying to the baby, they still get the monoclonal antibody?
It's it's a little fuzzy on how it's written. Of if a mother takes the shot, maybe the baby can avoid the Beyfortus, but the mother doesn't. Now, I published on my Substack back in January because this RSV vaccine for pregnant women came out. In fact, the CDC says vaccination for pregnant people, August 30th of 2023. the rates of vaccination for this as of January was only 10%. So pregnant women weren't buying off on this, but many of them didn't know that the babies were being hit with Beyfortus. Now with Beyfortus, there are two clinical trials, two randomized trials in babies, and it's mixed. One of the trials shows increased rate of mortality, meaning that when the babies do get RSV, some of them get really sick, and it's thought maybe it's due to antibody-dependent enhancement. It's in the
Yes.
papers, yes.
Whatever happened to the 1960s, I was going to ask you about that we're talking about, the safety profile, but in terms of the efficacy, my understanding was in the 60s, it was really the second season that turned out to be a problem after it had exposure, trained your body to respond in a certain way. And we kind of learned from COVID with the constant mutations of respiratory viruses, which is why we've never really had a good respiratory viral vaccine. What's the consequences of having all these different sorts of RSV vaccines in terms of the microevolution of the virus itself?
Well, it's so relevant. You brought up mutations. So I summarized this paper January 11th of this year on my Substack, and it's a paper by Beach and colleagues from the University of Idaho. And the title of it is Molecular Modeling Predicts Novel Antibody Escape Mutations in the Respiratory Syncytial Virus Fusion Glycoprotein. I said, listen, now that you're mass vaccinating the babies, the virus is actually going to mutate and figure out how to get around the antibodies and probably be much more of a problem, a year or two later in life. When a little baby gets RSV, we give a nebulized saline or albuterol, sometimes budesonide. If they get really sick, okay, we can bring them in the hospital. We actually have monoclonal antibodies approved that we can actually give for acute RSV in the hospital. But this idea of preemptively giving monoclonal antibodies on the first day of life to baby is unprecedented. And then the shoe really dropped when Dr. Helene Ben-Noon, former INSERM researcher from France, reported that infant mortality on a population basis is rising since the rollout of Beyfortus in France.
I don't understand how this just goes on and it gets worse. Even as we're all trying to retrospectively go back and relearn what we thought we knew, so we touched on COVID RSV. It's just horrific. But then there's the flu shot that people think is kind of innocuous. And, that's a given that you have to get if you're a pregnant woman. I was shocked. I never knew this. That a Floria quadrivalent version, it says on the label, available data for a Floria administered to pregnant women are insufficient to inform vaccine-associated risks in pregnancy. Their fluvarin version says the vaccine should be used during pregnancy only if clearly needed. So that's what's written on the label. But politically, in the medical world, in the OBG world, it's all like, you better get your flu shot. By the way, while CDC admitted 2 years ago, I guess 2 seasons ago, it had a 14% efficacy rate, which probably means negative efficacy. So what do we need to know about the flu shot?
The flu shots are terribly disappointing. They're almost always out of date. They try to use modeling to anticipate what's called antigenic drift of the two major antigens, which is the hemagglutinin and the neuraminidase, the H and the N of influenza. The H, by the way, is the spike protein of influenza. And there's kind of a slow change. Influenza doesn't have big jumps in mutations. And most of the time, the vaccines are very disappointing because when we calculate a vaccine efficacy without randomized trials, non-randomized data are used, and they're very biased. Remember, the non-randomized studies overestimate vaccine efficacy. If we have randomized trials, we'd have a much more modest efficacy result always. So we have to consider this. So the non-randomized studies, which are biased towards, falsely portraying better efficacy, most years, as you point out, are below 30%, below 20%. And the only thing we care about is reductions in hospitalization and death. Just getting a drippy nose at home, that doesn't count. And so because the data are so sparse, Daniel, we actually can't look at the point estimate. The point estimate is that 16% that you spotted. We actually have to look at the confidence intervals. The confidence intervals say, listen, that 16% could be anywhere within a 95% confidence interval. And we always use the lower bound of the confidence interval. For most years, the lower bound of the confidence interval is below 0, meaning essentially the vaccines don't work.
And my concern again is about negative efficacy, and maybe it's not as bad as COVID or the RSV shots. But one of the things that's been eye-opening is that, people like you and Dr. Ryan Cole you've really taught a generation of laymen like us what a T cell is, that there's, the immune system is multifaceted. And I have seen a dozen studies, and a lot of them are over the last 20 years, that seem to indicate that the flu shots do run the risk of tamping down your T cell immunity so you could get immune suppression. So isn't there a concern that it's not just, I used to think, all right, it probably doesn't work that well, but maybe not a problem. But in the long run, could it compromise your immune system?
Well, there may be some acute changes. I mean, probably some people listening, Daniel, will write in and they'll tell you, listen, I took a flu shot and the next week I got the flu. This is common. And we saw that with the COVID vaccine. So with the first shot of the COVID vaccine, there was an explosion of new cases of COVID. So these shots actually tend to backfire in the first week or two. It's been commonly reported. Now, there is a more rational form of a flu vaccine. It's called the nasal mist, where you actually just squirt some viral particles up in the nose, and it's done for children. Now, the downside there is the children then can actually shed influenza on other people. So the nasal mist flu shots don't work. Now, as you pointed out, this has really gone to the extreme. So May 31st, Moderna announces that their messenger RNA respiratory syncytial virus vaccine is approved for adults. So they do a big trial called Concord RSV. Again, rates of RSV is way lower than 1%. Vaccine efficacy is not that impressive. Lower bound of the confidence interval is about 60%. And so it's really no better than the Pfizer or the GSK product. Now it's a genetic vaccine. They only have 3 months of follow-up on the primary endpoint as much as 8 months.
And again, Dr. McCullough, just so we know that they want everyone to get this, but for now the trial was in those over 60.
Right.
So how do you have risk reduction and outcomes when people don't get seriously ill from RSV unless they're infants?
Well, if you do a big enough trial, let's say there's 20,000 people in each group, and there's 20 cases of people testing positive for RSV. They're not sick, but they test positive for RSV in the placebo group, and there's 8 cases in the active treatment group. You'll have more than a 50% risk reduction in people testing positive. Now, they're not meaningful outcomes. And so they've tried to say, listen, you got to at least have a cough or a fever or something. It's such a mild infection. And again, in my clinical judgment, the only thing that counts is hospitalization and death. If you're not hospitalized, you don't die. These little viral infections, you can't tell one from another. Honestly, we all get 4 to 8 of these a year. So it's clinically meaningless. And the shocking thing here is this is the first messenger RNA vaccine that's not emergency use authorized as its entry. The FDA chooses not to have a VRBPAC meeting. They don't have an advisory committee meeting. They just rubber stamp the approval with no assurances on long-term outcomes. Very, very, unstable point estimates on efficacy. So now we have Pfizer, we have GSK, and now we have Moderna competing for the over 60 RSV market. This is a condition I've never seen in my adult clinical practice.
And what I couldn't fathom, I don't have the quote in front of me, but at the ACIP hearing of, it was either GSK or Pfizer, because they were both approved for seniors, only Pfizer obviously for pregnant women. And one of the members acknowledged that it tends to overstimulate the immune system, which is why we are only approving it for seniors. And I'm thinking, wait a minute. You admit it overstimulates, and the scope of the risk of the virus is so low to begin with. So seniors, yeah, we'll just put it on them. But then, second of all, I would imagine the pregnancy shot is probably pretty similar as well. So if the senior shot overstimulates the immune system, wouldn't it be a pretty safe bet that there's a risk the pregnancy shot overstimulates the immune system? What does an overstimulated immune system do to a fetus?
Well, I think the first risk is overstimulated immune system means miscarriage, stillbirth, or premature delivery. And that's a disaster for the fetus. The first two result in fetal demise. The baby dies. And
And this is not speculation. The GSK's shot was pulled because of the preterm births. And I've seen them say things like, well, we take care of preterm babies pretty well nowadays. Like, that's not a big deal.
No, it's any parent out there with a premature baby, you know how it is. I mean, I'm so fearful of the intraventricular hemorrhage that's spontaneous and the baby's having cerebral palsy, being neurologically damaged. It's a disaster. You want the baby to go to full term. You do not want a premature baby. That's no picnic. Very, very hard on the parents and the child. But what we know here is that already Pfizer, I believe, has done a messenger RNA vaccine trial in pregnant women that we anticipate all the same problems with messenger RNA in the RSV vaccines as the COVID vaccines. For example, Crossan and colleagues has found messenger RNA in the human heart. So whether it's COVID vaccine or the RSV vaccine, the messenger RNA is going to target the heart and cause myocarditis. The Moderna Epstein-Barr virus program has already been paused because of myocarditis. So we know this is going to be common to all RSVs because all messenger RNAs. Because the messenger RNA is pseudo-uridinated, it's not natural, it's synthetic. Human ribosomes have a hard time reading it when it gets to certain points of pseudo-uridination, and there's what's called wobble. And so the ribosomes don't know what to do, and they grab the wrong transfer RNA and bring in the wrong amino acid, and it produces frame-shifted peptides. This is very important. So you're not just getting the pre-fusion protein with now this new Moderna vaccine. You're actually getting the pre-fusion protein, plus you're getting probably a dozen frame-shifted proteins. In a paper by Boros and colleagues, I'm a co-author, he clearly demonstrated this. And these proteins will be expressed on cell surfaces. They'll incite autoimmunity, probably create a whole variety of side effects we can't possibly anticipate. We should never have foreign or abnormal proteins being produced in a natural human body, of which the body is, thermodynamically in balance, producing all the proteins it needs.
And also to that point, using mRNA for the RSV shots, do they run the same risk that we're now seeing with COVID, growing evidence of roping in DNA to the nucleus? Is there a concern? I know we have the DNA plasmid contamination that may or may not be unique to the COVID shots, but is that an endemic risk of any mRNA platform?
Yeah, I put that in my Substack. There's no emergency right now to get a messenger RNA RSV shot on the market. They should have slowed down, done genotoxicity studies, tried to confirm what Alden and Yang D. Marinis demonstrated in Malmö, Sweden, where at least the center portion of Pfizer, the 444 base pair amplicon, where that clearly got integrated into human DNA, in a human hepatoma cell line, needs to be tested in somatic cells, a variety of models, needs to be tested with every messenger RNA product. But there's been no study to refute the Alden paper. So as we sit here today, I'd say yes, people who took Pfizer, Moderna, or they're now going to take additional messenger RNA vaccines, until we know otherwise, we should assume that they are altering their own genome. The human genome is permanently changing.
And again, with the back to the efficacy issue, I think we have to broach this, that we now have a number of studies that have found a surge in IgG4, these tolerating antibodies that basically serve as a Trojan horse to guide the virus into your body to tolerate it rather than neutralize it. We have an Ohio State study out recently that monitored. It was low sample size, but very divergent outcomes. So high powered, showing that in their hospital system, worse mortality, not just the more you inject, the more you infect with the COVID vaccines, but worse mortality outcomes. And one of the things they posit is that they simultaneously found in the serum among the people vaccinated, unvaccinated, came in with COVID, serious COVID. They tracked their mortality rates, and I think it was 70% in the vaccination group, maybe about 36% in the unvaccinated group. Even adjusting for health status, it was, again, very, very strong correlation there. And one of the things they found, Dr. McCullough, was that the vaccinated group had a surge of IgG4. So
Mm.
again, is this unique to the COVID shots, or do we now have to be concerned with this torrent of other vaccines? Well, Daniel, look at your titers. You got antibodies. Well, I didn't know any better. I was a layman. I was like, oh, that's great. Antibodies. That sounds. But do we have to be concerned now with some of these other respiratory viral vaccines that there is a negative efficacy possibly resulting from this surge in IgG4?
No, I think it's going to be restricted to messenger RNA vaccines because they give such a prolonged exposure to the antigen and they're given in multiple shots. So if the body keeps getting stimulated with the same exact antigen over and over again, day by day by day, the immune system turns off. And sure, there are antibodies to the spike protein, but they're not IgG class 1 or 2, which are neutralizing antibodies. They're IgG class 4. And so the resultant state's a disease-promoting state, and that was shown in a paper by Yonker and colleagues from Harvard, published in Circulation. So young boys who were suffering heart damage from Pfizer and Moderna were hospitalized, and they found that the children sustaining heart damage, myocarditis, had spike protein, but had antibodies, probably IgG4, that couldn't bind the spike protein. So the spike was damaging the heart. Whereas the children who were fine had spike, but they had neutralizing antibodies that mopped up the spike. So I think this IgG4 subclass switching may be a proxy for unabated spike protein damage to the body. So when people get COVID, they just do worse. And then there are a few papers suggesting the antibodies themselves may actually be pathogenic. We're not so sure about this, but you don't want IgG subclass 4 around. The reason why I don't think this is going to happen with other vaccines, let's say MMR, is because when you look at MMR, a few months or a few years later, the antibody titers are zero. You just don't have any. And it happened to me. I took the MMR a couple times. I took the full schedule. I showed up for medical school, and they measure my titers, and you don't have anything. And then you give you a shot. You measure it a few years later, you don't have anything. Same thing with hepatitis B. I don't think I've ever had titers.
Is that why all these recent measles and mumps outbreaks we had in the Texas, we've had in maybe Spain or Portugal, that it seems like we're getting a lot of these outbreaks? And in my pre-COVID mind and limited knowledge, I figured, because they're unvaccinated. But then the more we look into it, that's not really true.
Right. There's a paper, Fadke and colleagues in JAMA, that summarized both pertussis and measles outbreaks. And it was clear a large fraction are in the vaccinated because the vaccines just don't have durability. When you think about it, it's kind of a pipe dream that you give a little baby a shot and then people are protected into adulthood. It's just, it's a pipe dream. It turns out not to be the case. Probably the majority of us have zero protection against measles, mumps, rubella, and it's just kind of the way it is. Interestingly, measles is a very mild illness. I was at a meeting and someone showed the Brady Bunch clip when Peter came home with the measles, and everybody got the measles, including the parents and Alice, and everyone took a few days off work and they were fine. We haven't had a measles death in the United States for decades. It just doesn't happen. It happened overseas in some really severely nutritionally malnourished kids, vitamin A deficiency. Measles is basically a skin rash. It's not something we need to vaccinate for.
I used to think growing up it was something really scary from archaic times. But then when I saw they vaccinated against chickenpox that I still got, my generation, I'm thinking, well, I guess the next generation thinks that chickenpox is something crazy. But I mean, this is what it is, this vaccine ideology that there might be a place for certain vaccines for certain people for certain times and places. But like any medicine has to be precise. The vaccine ideology is basically, to sum up our discussion, it's like they view it as if it's a vitamin D gummy. It's just, hey, it can't hurt. So just more and more and more and more and more. And of course, no, there is a harm with any intervention. Some of them have significant harms. So that's when you have to already start weighing it. But then they don't want to ever have that discussion. And I think we need to send this around to everyone so they're armed with this. We might not be able to help ourselves politically yet, but certainly at a personal, individual medical level, we could take our medical freedom in our own hands. Dr. McCullough, there's so much more on your Substack I wanted to get to. We'll have to do this again. But again, where could people find out more about your, just all your studies that you're looking at?
Let me cite a reference that's out this week on America Out Loud Talk Radio McCullough Report. And it's titled Unavoidably Unsafe. And it's a book review, two doctors, Dr. Gear and Dr. Barkey. I think everybody, all the parents ought to pick this up. It goes through the schedule shot by shot by shot, describes the studies, the risks and the benefits. And these doctors are like me. We took all the shots, so we're not anti-vax, but it's just now saying, listen, everything has risks and benefits. We have to think our way through this. There's 5 studies showing that if the children go natural, they don't take any shots whatsoever, they actually have better health outcomes than the fully vaccinated. Makes sense. They don't have chances of vaccine side effects, but there's lower rates of allergic diseases, attention deficit disorder, autism, and other neuropsychiatric disorders. So it's something to consider. Going natural during pregnancy and during childhood for normal, healthy people is at this point in time reasonable. It's advised, by the way, by the World Council for Health, which is a worldwide body that makes recommendations on this. So make sure you follow me on America Out Loud Talk Radio, McCullough Report, Courageous Discourse Substack. Sign up for the Substack, everybody. It's not, the vast majority of content is free. All the late-breaking trials, abstracts, everything you need there, videos. My book, CourageToFaceCovid.com. And follow me on social media. I got the Top Doctor account on Twitter of doctors who see patients and are engaged clinically. I've just been trying to bring people the truth. I don't like what I see in this vaccine ideology. It's become like a religion, and it's not safe for patients right now.
It's really not, and it's because of your work that a lot of us that just didn't know where to turn, we can now work on this, and you don't have to remember all the citations. You can find them at Peter McCullough MD Substack, again at P_McCullough MD. Dr. McCullough, man, this was as enlightening as it was scary, but we got to do this. We got to get the information out. Thanks so much for everything you do, and looking forward to having you back.
Thank you.
Take care.